Hospitals are like their own little universes filled with heroes, villains, and people who've seen things they can never unsee. From doctors who think they're gods to nurses who actually run the place, every role comes with its own stereotype. But remember, these are generalizations. Most hospital workers are just trying to save lives while surviving on terrible coffee and even worse sleep schedules. The emergency room doctor. These adrenaline junkies live for trauma cases and treat every other specialty like it's beneath them. They drink 6 espressos per shift and somehow still complain about being tired. ER docs have this unshakable belief that they're God's gift to medicine. Clinic work feels like punishment to them. They only come alive when someone's coding or there's a car accident victim rolling in. Ask them about their job, and they'll spend 20 minutes explaining why emergency medicine is the only real medicine. They look down on dermatologists for having normal hours, and cardiologists for being too slow. Every other department thinks they're arrogant jerks. But here's the thing. While everyone else is doing paperwork and scheduling follow-ups, these caffeine-fueled warriors are actually saving lives and making split-second decisions that determine whether someone goes home or doesn't. The nurse. Overworked, underpaid, and the people who actually run the hospital while doctors get all the credit. Nurses have zero tolerance for doctor nonsense and will call them out on their mistakes without hesitation. They remember every patient's name, medication schedule, and family drama while juggling 12 other tasks. Here's a fun fact. Nurses can find a vein on anyone, even in complete darkness, while half asleep after a 12-hour shift. They work 3 brutally long shifts per week and feel like death incarnate. Doctors write orders, but nurses are the ones who notice when something's wrong at 3 in the morning. They're the ones holding hands during scary procedures and explaining things in actual human language instead of medical jargon. New residents fear them more than their attending physicians. Hospital administrators undervalue them constantly. But nurses are the real MVPs who catch doctor errors, remember the little details that save lives, and actually show empathy when patients need it most. The surgeon. They have a god complex the size of their malpractice insurance and bedside manner that would make a cactus seem warm. Surgeons drive Porsches or Teslas and refer to themselves in third person like they're an entirely different species. Ask any surgeon about their hands and prepare for a 20-minute monologue about their God-given gift. They treat everyone in the operating room like they're assisting them personally, even the attending physicians. Terrible at explaining things to patients in normal words. Their entire personality revolves around the fact that they cut people open for a living. Other doctors think they're arrogant. Nurses think they're insufferable. Patients are terrified of them. But you know what? Their massive ego is actually backed by legitimate skill and years of brutal training that would break most people. They'll operate at 3 in the morning to save your life without hesitation. When you're dying on the table, you want the surgeon with God hands and the personality of a rock, not someone who's nice but mediocre. What's the worst bedside manner you've experienced? Let me know in the comments. The ER waiting room. Welcome to fluorescent hell where time moves differently and 4-hour waits for a sprained ankle are considered normal. There's always at least 3 crying babies, someone coughing without covering their mouth, and a guy who Googled his symptoms and diagnosed himself with cancer. People sleep across 3 chairs like they're camping. The TV is always stuck on the same news channel from 2012. Everyone looks miserable because they are. You'll see parents with kids who ate crayons sitting next to someone who thinks a paper cut requires emergency intervention. That one person comes in every single week for various mysterious ailments. The chairs are designed by someone who hates human spines. Time genuinely operates differently here. 5 minutes feels like 2 hours, and 2 hours feels like an eternity in purgatory. But here's the beautiful thing. This is democracy in action. The billionaire with chest pain waits just as long as everyone else. Money can't skip the triage line when everyone's actually sick. Medical residents sleep. Deprived zombies who haven't seen sunlight in approximately 3 weeks and live exclusively on vending machine food. And spite. These poor souls work 80-hour weeks for what basically amounts to minimum wage when you do the math. They cry in supply closets, fall asleep standing up mid-sentence, and have forgotten what their families look like. Residents can recite every bone in the human body, but can't remember if they ate lunch yesterday or 3 days ago. They're running on pure caffeine and the fading dream of eventually becoming real doctors. Attending physicians treat them like servants. Nurses correct their mistakes constantly. Patients ask if they're old enough to be doctors. Their hands shake from exhaustion during procedures. They've made friends with the night janitor because those are the only other humans they see. Medical school prepared them for the knowledge, but nobody warned them about the soul-crushing fatigue and existential dread. But despite everything, they're earning their stripes and learning their craft. If they survive residency, they'll become incredible physicians who remember what it's like to be human. The hypochondriac patient. These frequent flyers have Googled every symptom imaginable and diagnosed themselves with 14 rare diseases that definitely aren't just anxiety. They're absolutely convinced they're dying from something exotic. The ER sees them regularly for headaches that WebMD said were brain tumors. They bring printed articles to show the doctor, highlighted and annotated. Every minor ache becomes a catastrophic medical emergency in their minds. They know more medical terminology than most nursing students, but understand none of it correctly. Their search history would terrify any physician. Doctors try to reassure them, but they're already on to the next self-diagnosis. They've had 47 blood tests this year, and all came back normal, but they're certain the doctors missed at something. Facebook medical groups have convinced them they have conditions that don't exist. Staff groan when they see their name on the schedule. But occasionally, very occasionally, their obsessive vigilance actually catches something real early. Sometimes the hypochondriac is right and that annoying persistence saves their life. Anesthesiologist, the highest paid person in the operating room who literally sits down all day, does crossword puzzles during surgery, and makes $400,000 annually. Here's their entire job description. Show up, put patient to sleep, read newspaper, maybe check vitals. Wake patient up, send massive bill. Nobody actually knows what they do, including other doctors. They're like the Maytag repairman of medicine. Everything goes smoothly, so it seems like they do nothing. Surgeons get all the glory, while anesthesiologists just vibe in the corner. They went to medical school for a decade to babysit sleeping people. Medical students joke about choosing anesthesiology for the lifestyle and money. They have better work-life balance than everyone else combined. Other specialties are secretly jealous. Patients forget they exist entirely. But here's the reality. Anesthesiologists are literally the only thing standing between you and feeling someone cut you open. They're managing your pain, keeping you alive during surgery, and monitoring 50 different vital signs simultaneously. When something goes wrong, they're more important than the surgeon. You just don't notice because they're that good. The break room. The sacred sanctuary where hospital staff escape to consume coffee that could strip paint and food that's been in the fridge since 2019. Passive-aggressive notes cover every surface. Someone's expired yogurt has achieved sentience. The microwave smells like a crime scene because someone heated fish again. This room has seen more drama than any patient room. Your lunch will absolutely be stolen even if you label it with threats. The coffee maker is older than most residents and produces liquid that's technically classified as a controlled substance. Nurses hide from difficult patients here. Doctors avoid angry families. Residents cry quietly in the corner. Everyone complains about administration. There's always one person who takes hour-long breaks, while everyone else gets 5 minutes. The fridge cleanup happens quarterly and requires hazmat suits. Used to be someone's job to monitor this, but they quit. But despite the passive aggression and theft, this is the only place where different departments actually talk to each other like human beings, instead of just paging. Hospital administrator. These people have never actually touched a patient, but make 10 times what nurses earn, while only caring about metrics and cost reduction. They use corporate buzzwords in every single sentence. Synergy, optimize patient flow, leverage our assets, circle back, touch base. They send 47 emails daily that could have been one sentence. Hospital administrators live in a different reality than the clinical staff who actually see patients. They make decisions about patient care from boardrooms, while doctors beg for basic supplies. Their solution to nursing shortages is pizza parties and empty gratitude. They care more about hospital rankings than patient outcomes. Staff universally despise them. They've never worked a night shift or cleaned a bedpan, but have lots of opinions about efficiency. Now look, these are all stereotypes. Not every hospital administrator is a soulless corporate robot. Some actually care about patients too. And in fairness, they're keeping the hospital from bankruptcy and handling the business side so doctors can focus on medicine. Someone has to deal with insurance companies and government regulations. It's a necessary evil that nobody wants to do. Radiologist. These social recluses never see actual patients and live in dark rooms staring at screens like cave-dwelling hermits who forgot how to interact with humans. Radiologists are so socially awkward that even other awkward doctors think they're weird. They can diagnose your cancer with stunning accuracy but cannot make eye contact to save their lives. They communicate exclusively through electronic notes. Never attend meetings. Avoid hospital events. Probably don't remember what sunlight looks like. Other doctors page them and get back reports, but never actually see them in person. It's rumored they live in their radiology department basement. Patients never meet them. Nurses aren't sure if they're real or just advanced AI. They chose this specialty specifically to avoid human interaction. Medical students who hate people become radiologists. They're basically the IT department of medicine. Everyone needs them, but nobody wants to talk to them. But here's the thing. Radiologists catch the things everyone else missed. They work alone because they're actually focused and brilliant. While surgeons are busy having God complexes, radiologists are quietly finding the tumors that save lives. Code Blue. Organized chaos erupts when those two words echo through the hospital, and suddenly everyone's sprinting toward the same room. Someone yells clear while charging the defibrillator. Nurses are doing chest compressions. Doctors are barking orders. The pharmacist appears out of nowhere with emergency drugs. It's dramatic like television shows, but messier and sadder and smells worse. The crash cart always has one broken wheel that makes it impossible to steer properly during the rush. Someone inevitably forgets to plug in the defibrillator. Medical students stand frozen in the corner trying not to pass out. Family members are being ushered away by security. Time dilates weirdly during codes. 2 minutes feels like 20. Everyone's talking over each other, but somehow communication happens. The room's packed with 15 people, all doing their specific job. Equipment is beeping frantically. Someone's calling out timestamps. New residents are sweating through their scrubs. Veteran nurses have seen this 1,000 times, but still give everything they've got. Sometimes it works. Sometimes it doesn't. But this is the moment when all that training kicks in, and a collection of individuals becomes one organism fighting death together. The operating room, the coldest room in the entire hospital, where 47 different machines are beeping simultaneously, and everyone's yelling at each other, but apparently that's totally normal. Surgeons act like Gordon Ramsay, throwing tantrums over instruments. Nurses have heard every insult imaginable and remain unfazed. The anesthesiologist is chilling in the corner doing a crossword puzzle. There's an ongoing eternal debate about the temperature. Surgeons want it colder. Everyone else is freezing. Someone's always playing their Spotify playlist, usually classic rock or death metal. Why death metal during surgery? Nobody knows. The scrub techs know where every instrument is, but surgeons still blame them when things go missing. Operating rooms have their own culture and hierarchy that outsiders will never understand. New surgical residents get destroyed verbally during their first cases. Attending surgeons have legendary meltdowns over minor inconveniences. But when everything clicks and the team works together perfectly, this is where actual miracles happen. This is where surgeons remove tumors, replace hearts, and reattach severed limbs. The yelling and chaos produces life-saving results. Pediatrician. These angels walk among us talking in baby voices to everyone, including fully grown adults, and their offices look like cartoon characters exploded everywhere. Pediatricians are genuinely too nice to exist in the real world. They chose lower pay specifically to work with children instead of pursuing more lucrative specialties. Every surface in their office has stickers, toys, or bright colors. They have approximately 47 different sticker varieties and give them to adult patients too, because why not? The baby voice never turns off even during lunch with colleagues. They can't help themselves. Other doctors find it slightly unnerving. They're explaining complex medical information in voices meant for toddlers. Pediatricians genuinely get excited about seeing sick kids get better. They remember every patient's birthday. They wear fun scrubs with dinosaurs and superheroes. They've mastered the art of giving shots while distracting kids with jokes. Parents either love them or find them annoying. There's no in between. Medical students who choose pediatrics are the ones who still have faith in humanity. But these wonderful humans chose the specialty because kids deserve doctors who actually care and make medicine less terrifying. Psychiatrist. They've analyzed your entire personality within 30 seconds of meeting you, and definitely have their own therapist to deal with analyzing everyone constantly. Psychiatrists ask, how does that make you feel about literally everything, including lunch choices? They take notes during casual conversations with friends and family. Can't turn off the professional observation mode. They see patterns in your sandwich preferences. Every statement you make gets quietly filed away for later psychoanalysis. Other doctors think they're weird. Patients are terrified of being transparent around them. They've heard every possible human problem and nothing shocks them anymore. Psychiatry residents attract a specific type of person who's fascinated by the darkness in human nature. They deal with patients other specialties refuse to touch. Suicidal teenagers, psychotic breaks, severe schizophrenia, treatment-resistant depression, the cases that terrify regular doctors. Insurance companies treat mental health like it's optional, so psychiatrists constantly fight for their patients. They're overbooked and underpaid compared to other specialists. Society still stigmatizes mental illness, so their work gets dismissed. But psychiatrists actually listen to patients and treat conditions that destroy lives just as surely as cancer does. The "I know better than you" patient. These folks argue with every diagnosis because they did research on Facebook, and their cousin's neighbor had something similar once, so clearly they're experts now. They refuse recommended treatment, but won't leave the hospital either. Every sentence starts with "my cousin had this," and he said, or "I read online that." Doctors are trying to explain actual medicine while patients are citing random blogs and conspiracy theories. They question every test, every medication, every recommendation. WebMD made them dangerous. YouTube videos convince them vaccines cause everything bad ever. They know more than doctors who spent a decade in medical school, apparently. Nurses want to scream. Doctors practice deep breathing exercises. These patients will literally argue about their own blood test results. "Sorry, doc, but I don't think my cholesterol is high." The machine must be wrong. They demand antibiotics for viral infections. They refuse imaging that could save their lives. Medical staff fantasizes about making them sign liability waivers. At least they're engaged in their health care, even if dangerously misinformed. That's something. Better than people who ignore health completely. Sort of. Night shift. The skeleton crew emerges when the sun goes down, and the weirdest patients materialize from the darkness like hospital gremlins. Everyone's running on pure delirious energy, and the vending machine becomes gourmet dining at 2 in the morning. 3 a.m. is when the truly bizarre calls happen. I swallowed my AirPod. I have a light bulb stuck somewhere unfortunate. My pet hamster bit me, and now I think I'm transforming. Night shift workers are a completely different breed of human. Tougher, weirder, more bonded than day shift could ever understand. They've seen things that would make day shift workers quit immediately. The hospital feels different at night, quieter, but somehow more chaotic. Fewer staff means everyone does multiple jobs. The cafeteria is closed, so cold pizza from the break room fridge becomes dinner. Nurses run the entire show because there's like 2 doctors for the whole hospital. Strange things happen in the darkness that nobody talks about during morning rounds. But night shift crews keep the hospital running when most people are sleeping. They handle emergencies with half the resources and twice the weird. Respect the night shift. They're built different. Receptionist. These gatekeepers control your entire medical fate with a single mouse click and have perfected the art of passive aggression regarding appointment times. Receptionists have survived every possible Karen variant humanity can produce. They can type 120 words per minute while simultaneously giving you a death stare that withers souls. They know your insurance information better than you do. They've heard every excuse for missing appointments. They've been yelled at for things completely beyond their control, like wait times and insurance denials. Patients treat them like servants. Doctors treat them like furniture. But receptionists run the front desk operation that keeps the entire practice functioning. They're fielding 50 phone calls while checking in patients and dealing with billing issues, and somehow not strangling anyone. They've mastered the fake smile, the professional tone that barely masks contempt. They know which patients are nightmares before they even walk in. The computer system crashes daily and they fix it themselves because IT is useless. These underappreciated warriors shield medical staff from nightmare patients and manage absolute chaos with grace daily. Without receptionists, the whole system collapses immediately. The ICU. The quietest floor in the hospital where everyone whispers and each room contains a life hanging in the balance by the thinnest thread imaginable. This is where the sickest patients fight for survival. The most skilled nurses work here because mistakes mean death. Every beeping monitor represents someone's parent, child, or partner. Families sleep in uncomfortable chairs for days. The beeping never stops. Ever. It becomes white noise that ICU staff don't even hear anymore. Each nurse manages maybe 2 patients maximum because the care is so intensive. These aren't stable patients. These are touch-and-go situations. Ventilators breathing for people, dialysis machines doing kidney work, hearts barely pumping. ICU nurses can run a code in their sleep. They've seen more death than most people can imagine. Doctors who work ICU actually give a damn because you can't phone it in here. Every decision matters. Every vital sign change could indicate disaster. Walking into the ICU feels heavy. The air is different. Time moves strangely. But this is where people fight death with every resource medicine can provide. And sometimes, miraculously, they actually win. Pharmacist. They spent 6 years in school and accumulated massive debt to count pills and silently judge your prescription choices while knowing you're definitely lying about it's for a friend. Pharmacists can read doctor handwriting that looks like ancient hieroglyphics or drunken chicken scratches. This is an actual superpower that nobody properly appreciates. They're the last line of defense between you and dangerous drug interactions that could kill you. Doctors prescribe things. Pharmacists catch the lethal combinations and contraindications. They're calling doctors constantly about dosing errors and drug interactions. They know more about medications than most physicians, but people treat them like glorified cashiers. Patients get angry about wait times and prices like pharmacists control either. They're back there verifying insurance, calling for authorizations, checking interactions, counseling patients, and filling prescriptions as fast as humanly possible. The job is way more complex than counting pills. They're managing controlled substances, dealing with insurance nightmares, and preventing medical errors daily. Pharmacists have stopped countless overdoses and caught mistakes that would have destroyed lives. They're unsung heroes of medication safety, keeping people alive with chemistry knowledge and attention to detail. The veteran nurse. They've seen absolutely everything the human body can do and trust absolutely no one, especially fresh residents who showed up thinking they know things. Veteran nurses run their floor like military operations with zero tolerance for incompetence or nonsense. They can predict exactly which patient will code just by looking at them, and they're never wrong. New nurses fear them. Residents are terrified of disappointing them. Even attending physicians respect their judgment. These battle-hardened warriors have worked every holiday for 20 years. They've cleaned things nobody should have to clean. They've held dying patients' hands when family couldn't be there. They've seen medical fads come and go. They remember when things were done differently and aren't impressed by new protocols. They're teaching the next generation even while complaining about kids these days. They know every shortcut, every supply closet, every unwritten rule. Hospitals would completely fall apart without their institutional knowledge. Their bedside manner might seem harsh, but it's honest. They don't sugarcoat. They've earned the right to be grumpy. The hospital wouldn't function without their expertise and experience. Pediatrics ward. Colorful walls are hiding profound sadness behind Disney characters and toys scattered everywhere with brave kids and emotionally destroyed parents trying to hold it together. This is the hardest floor emotionally in the entire hospital. The staff chose this specialty knowing they'd see sick children daily. Pediatric nurses are literal angels walking among us. They've mastered staying cheerful while breaking inside. The decorations look like Disney World threw up everywhere, but it genuinely helps kids cope with terrifying medical situations. Child life specialists organize activities to make hospitalization less traumatic. There are therapy dogs visiting, volunteers reading stories, clowns performing magic tricks. Yes, actual clowns work here. Every surface is designed to distract from the reality of childhood illness. Parents sleep on tiny, uncomfortable chairs, refusing to leave their babies. Siblings visit and don't understand why their brother or sister can't come home. The laughter sounds different here, more precious, more fragile. Staff celebrate tiny victories that would seem insignificant elsewhere. A kid eating solid food, taking 3 steps, smiling for the first time in weeks. These warriors chose the emotionally devastating specialty because sick kids deserve the absolute best fighters in their corner. The medical student. Eager puppies who ask far too many questions and are constantly in everyone's way while practicing their serious doctor voice in bathroom mirrors. Medical students take 45 minutes to accomplish what experienced nurses complete in 5 minutes. They carry approximately 18 medical textbooks everywhere, like they might need to reference something immediately. Attending physicians use them as personal assistants. Residents haze them mercilessly. Nurses tolerate them barely. Patients ask if they're old enough to practice medicine. They're simultaneously learning and trying to appear competent, which results in awkward interactions. They rehearse patient presentations obsessively. They study until 3 a.m. and show up at 5 a.m. for rounds. Medical school costs a fortune and destroys their mental health, but they persist anyway. They haven't developed the emotional calluses yet. Death still affects them deeply. They cry after losing patients. They actually remember why they wanted to become doctors. The cynicism hasn't crushed their souls yet. Other staff find their enthusiasm annoying but also refreshing. Medical students still have empathy and genuine desire to help people before the system beats it out of them completely. Visiting hours. Families flood the hospital, asking identical questions repeatedly and getting in staff's way while emotional scenes unfold, and someone's always crying somewhere. There's always that one family member who watched too much Grey's Anatomy and now questions every medical decision like they're suddenly experts. Why are you giving that medication? What are his numbers? Shouldn't you run more tests? Did you check for this rare condition I Googled? Staff practice patience while explaining things for the 15th time. Multiple relatives want updates from different doctors, creating communication chaos. Someone's filming on their phone. Another person is arguing about visiting restrictions. Kids are running in hallways. Flowers are everywhere despite allergies. Outside food appears despite dietary restrictions. The waiting room becomes a second home for families camping out during long hospitalizations. They're scared, exhausted, and grasping for control in powerless situations. Staff understands this intellectually, but it's still overwhelming when 30 family members descend, asking questions simultaneously. But that moment when a patient's face completely lights up, seeing their loved one makes all the chaos and hassle absolutely worth tolerating. Family presence heals in ways medicine cannot. Janitor. These invisible workers know absolutely everything happening in the hospital because people talk freely around them like they're furniture, but they've seen things they can never unsee. Janitors have cleaned every conceivable bodily fluid in every imaginable location. Blood, vomit, other things we won't name. They've mopped up crime scenes, basically. They've cleaned rooms after codes and after deaths and after surgery's gone wrong. The smell never completely leaves. They show up daily anyway. Everyone except nurses treats them as invisible. Doctors walk past without acknowledgement. Patients don't make eye contact. But janitors hear all the hospital gossip. They know which doctors are sleeping together, which nurses hate each other, which departments have drama. They could write books about what they've witnessed. They work night shifts and weekends and holidays. They're exposed to infectious diseases constantly. The pay is terrible for such essential, disgusting work. Hospitals would become biohazard zones within hours without them. They deserve significantly more respect and appreciation than they receive. These unsung heroes do the job absolutely no one else is willing to do and keep the hospital from becoming a literal toxic waste dump. The double shift. Staff running on pure spite and caffeine are making mistakes waiting to happen, and unions would have an absolute field day if they knew what was happening. Someone called in sick, so healthcare heroes stepped up for back-to-back shifts, so patients don't suffer from understaffing. Around hour 16, the hallucinations begin. Did that chair just move? Are the walls breathing? Is that patient actually talking, or am I imagining it? Double shifts are dangerous. Reaction times slow. Judgment becomes impaired. But hospitals are perpetually understaffed, so workers cover gaps constantly. Nurses are picking up extra shifts to pay bills. Residents have no choice because it's built into training. Doctors are on call for 36 hours straight, somehow legally. Everyone's eyes are bloodshot. They're mainlining coffee that's probably older than some patients. The break room coffee maker is working overtime, just like that callback from earlier. Movements become mechanical, autopilot engaged. Just survive until shift change. Clock watching becomes obsessive. But these exhausted warriors sacrifice their health and safety, so the hospital keeps functioning and patients receive care they desperately need. Hospital, Cafeteria. Surprisingly expensive food that tastes like cardboard is always running out of the decent salad and operates on weird hours that make no sense to anyone. The healthy options are somehow nutritionally worse than just ordering the greasy burger. How is that possible? Nobody knows. This place stays open 24/7 because hospitals never sleep, which means you'll find night shift zombies wandering in at 3 a.m. looking for sustenance. The selection at 3 a.m. is basically stale muffins and questionable sandwiches. Medical students camp at tables studying surrounded by empty coffee cups. Families stress eat while waiting for surgery updates. Staff grab food between emergencies and eat standing up. There's always one person sleeping face down at a table. The prices are absurd considering the quality. $8 for wilted lettuce and sad tomatoes. But where else are you going at midnight in a hospital? They've got you trapped. The pizza is somehow both burnt and soggy simultaneously. The soup has been sitting for unknown hours. But it's fuel, and it's available, and sometimes that's enough when you're saving lives or waiting to hear if your loved one survived. The frequent flyer. Patient emergency room staff knows these regulars by first name because they show up weekly for various minor issues, and they're either lonely or drug-seeking or both. They have an unofficial rotating chart of complaints. This week, it's chest pain. Next week, mysterious abdominal issues. The week after, sudden onset back pain. Staff can predict their arrival patterns. Friday nights, holiday weekends, right when clinics close. They know exactly what to say to avoid being discharged immediately. The symptoms are always just serious enough to warrant examination. They're master manipulators or genuinely suffering, or usually both simultaneously. Some are homeless and the ER is warm and safe. Some are addicts desperately seeking pain medication. Some are elderly and alone, and human contact, even in an ER, beats crushing isolation. Medical staff get frustrated because resources are limited and frequent flyers consume time and attention. But these people are often dealing with homelessness, addiction, untreated mental illness. They need help. Just different help than an emergency room is designed to provide. The system is failing them repeatedly. Discharge day. Patients desperately want leave while families want them to stay longer, but insurance says time's up, so nurses are frantically completing 47 different forms simultaneously. Getting discharged takes approximately 6 hours, even though you just want to go home immediately. First, the doctor has to approve it, then pharmacy has to prepare medications. Then nurses do discharge teaching. Then you wait for prescriptions. Then you wait for the wheelchair. Then you wait for someone to actually wheel you out. Then you wait for your ride. Insurance companies are rushing discharges to save money. Families are panicking about home care responsibilities. Patients are signing papers without reading them. Nurses are explaining medication schedules 3 times. Do you understand these instructions? Yes. Narrator, they did not understand. Follow-up appointments need scheduling. Medical equipment needs arranging. Home health services need coordinating. It's logistics and bureaucracy and frustration. But underneath all the paperwork and waiting, this represents something beautiful. That moment when someone who arrived dying or broken walks out alive and healing makes every frustrating discharge worth the hassle. This is why everyone tolerates the chaos. So, yeah, those are all the hospital stereotypes explained. Some are definitely true and some are exaggerated, but they're all based on something real. Healthcare workers are trying their best in an impossible system. Let me know which stereotype I completely nailed or got totally wrong in the comments. And subscribe for more stereotype breakdowns, because apparently we're doing this for every topic now.